So perfusion is the circulation of an adequate amount of blood to meet the cell's current needs. That's what perfusion is. So we've seen this word once before, but from today on, I really want you to make sure you understand what the word perfusion means. So it really just means getting enough blood flow to all your tissues, and that blood flow is delivering the oxygen and nutrients that those cells need. So that's basically what perfusion is that all your cells are getting the supplies that they need. Adequate perfusion is just circulation of blood delivering all the stuff that your body needs. Okay, hypoperfusion is what shock is. So shock and hypoperfusion, these words are interchangeable. It's interchangeable. Down here at the bottom, you see shock is the same as hypoperfusion. It's also known as inadequate perfusion or poor perfusion. Hypo means low. So low perfusion or inadequate perfusion, that's what shock is. So remember, perfusion is adequate blood flow through the body, delivering everything you need. So shock is when your body's no longer able to deliver the nutrients that your body needs to all your different tissues and cells. So it's a state of collapse and failure of the cardiovascular system. It's a point where the cardiovascular system is no longer delivering the needs to your body. So as you go into shock, your blood circulation slows and eventually blood is no longer circulating. That's the sort of the end result of shock that causes death. So when you first go into shock, your body kind of tries to fight it to maintain homeostasis. Homeostasis just means that normal state where everything's balanced out. Okay. So shock can occur because of medical emergencies or from traumatic emergencies. So medical emergencies like a heart attack or an allergic reaction could cause shock, or traumatic emergencies like a car crash or a gunshot or a stabbing or anything like that can also cause shock. And we'll look at all sorts of different causes today. So when you have poor perfusion or hypoperfusion or inadequate perfusion, also known as shock, there's some things happening. So first of all, your body is not getting the nutrients it needs, but also all of your tissues have a buildup of waste and carbon dioxide because that blood is not getting to your tissues and picking up those waste products. So you get this buildup of all the waste and carbon dioxide in your blood and in your tissues because your blood's not coming there to take it away. And so this can damage all the cells of the body. So again, shock is just a state of collapse and failure of the cardiovascular system. So shock means that your body is not having enough circulation to carry around the blood and everything that you need. So shock is an unseen life threat. And it can come from a medical emergency or a traumatic injury. It could come from either one, an MOI or an NOI. If the cause of shock is not treated, most people will die of shock. So if the cause isn't treated, we can expect death to follow. Okay, so our cardiovascular system is made up of three parts: the pump, the pipes, and the contents, to put it simply. So our cardiovascular system, we have our heart that does all the pumping to move our blood around our body. Then we have our blood vessels, which are our pipes that carry that blood around the body to transport it. And then we have the contents, which is the blood itself. So the heart, the blood vessels, and the blood, also known as the pump, the pipes, and the contents. These are the three things that we need to have adequate perfusion, to have good circulation. So they call these things the perfusion triangle. The heart, the blood vessels, and the blood are the perfusion triangle because we need all three things to have good perfusion. So we're learning about shock today. We know shock is when you have inadequate perfusion or poor perfusion. So when someone's in shock, it's because one of these three things is failing. It could be that the heart is failing and it's not able to pump. It could be that the blood vessels are having a problem. Maybe they vasodilated, meaning they got really big and there wasn't enough blood to fill them anymore. Or there could be a problem with blood, like maybe you're bleeding to death. So this is the perfusion triangle. We need all three of these things to be intact to have good perfusion. When one of them fails, we can go into shock. So the perfusion triangle, again, is the heart, the blood vessels, and the blood. Okay, a couple other things to think about before we dive into this further. Let's go back to what blood pressure is. So remember, your blood pressure is the amount of blood or amount of pressure that your blood is pushing against the walls of your vessels at any time. So when you measure a blood pressure, and a very normal blood pressure is like 120 over 80. So let's say somebody's blood pressure is 120 over 80. Well, what that means is that their systolic blood pressure is 120 and their diastolic pressure is 80. So the systolic pressure of 120, that's the peak arterial pressure. What that means is that when your heart is pumping, when it's in systole, when it's actually pumping to squeeze blood out, it's putting the most pressure on your arteries. And at that point, it's 120 millimeters of mercury. The diastolic number is the low point in the wave, or the least amount of pressure that your blood puts on the walls of your arteries with each pump. And so that's when your heart's relaxing to refill with blood, and there's less pressure being pushed through your arteries. So what that means for somebody who has a blood pressure of 120 over 80 is that when their heart relaxes to refill with blood, their blood is only pushing against the walls of their arteries at a force of 80 millimeters of mercury. Pulse pressure is the difference between the systolic and the diastolic pressures. So you really just subtract the two numbers. So if somebody's blood pressure is 120 over 80, their pulse pressure is 120 minus 80, which is 40. If their blood pressure is 150 over 100, their pulse pressure is 50. You just subtract the two numbers. So if you think about what this number means, it's the amount of force that the heart is pumping with, right? If those two numbers are far apart, like 150 over 100, that means that the difference between the squeeze and the relax is 50 millimeters of mercury. It's more. Whereas if somebody's blood pressure is 125 over 100, then the difference between the squeeze and the relax is not very much. So, if somebody's blood pressure is 125 over 100, their heart might be doing this. Whereas if it's 150 over 100, their heart might be doing this. It's, pumping 25 more millimeters of mercury every time. So low pulse pressure, as those two numbers, the systolic and the diastolic numbers, start to get close to each other, it tells us that the heart's shutting down and not pumping as effectively as it once was. Okay, our blood flow goes through our capillaries, and that's all regulated by capillary sphincters. So what that means is that your capillaries can either get larger or smaller to control the flow of blood through them. And they use this to adapt to shock. That's why we're talking about it in this chapter. But this is all under the control of the autonomic nervous system. In other words, it happens naturally. It happens on its own. You don't have to do it yourself. Your brain just sends these signals. So to give you an idea of how this works, think about if you put your hand in hot water. If you put your hand in pretty hot water and you hold it in there for 30 seconds and you pull it out, you're going to notice that your skin has turned pink or red. That's because of the heat. Your capillary sphincters opened up so that the blood in your body would get closer to the skin, so that that blood could try to release heat from your body to try to get rid of that heat. So the capillaries opened up, or they dilated and got bigger, so that the blood can come to the surface of your skin. Now on the flip side, if you put your hand in snow and leave your hand under the snow for a minute and pull it out, you're going to notice that your hand is pale, and it's really, really pale. That's because all of your capillaries constricted, which means they got smaller, and they pulled blood away from the surface of your skin to try to retain heat so that your body doesn't get so cold. This also happens for oxygen and waste removal. If you go to the gym and you do a bunch of bicep curls, and you keep doing bicep curls, and you look down at your bicep, you'll notice that it feels really warm, and your skin there turns kind of pink or reddish. That's because your bicep needs more oxygen and has a lot more buildup of waste than it normally does. So the capillaries there are dilating, opening up so that more blood can flow to that area to deliver the nutrients and to carry away all the waste. So our body also does this to adapt to shock. So we'll go ahead and talk about that now. So to adapt to shock, what your body does is when you go into shock, when you're not having good blood circulation, your body decides what's the most important. Well, all of your vital organs are the most important in the core of your body, or your trunk. So all of your capillaries constrict to pull all the blood to your core, and all of your extremities are left with less blood flow, because our core is the most important. So that's another time that our capillaries constrict, is to bring blood to our core. Okay, so back to perfusion. We need a good working cardiovascular system. In other words, we need a good pump, we need good pipes, and we need blood. But we also have to have some other things happening. We need the blood to have the right contents. So we need good oxygen exchange in the lungs so that the blood can pick up O2. We need good nutrients in the blood in the form of glucose. So we need a certain level of blood sugar so that sugar in our blood can go to our cells to deliver those nutrients. And we also need waste removal, which we mostly do through the lungs. We need to be able to exhale off those waste products that are delivered back to the lungs from the body. So we have backup systems to keep our perfusion working when there's a problem. So when we start to lose some blood or our heart's not pumping as well, our body releases hormones to help us stay alive. And the goal of those hormones is to try to keep the blood pumping through our body and to keep all of our organs alive. You know, our heart, our brain, our kidneys, our liver. That's what our body's really focusing on, keeping good blood flow to. So when your blood pressure starts to fall, in other words, when you start to go into shock, otherwise known as hypoperfusion, your body instantly turns on its shock. It starts to fight the shock by increasing your heart rate. Not only does your heart beat faster, but your heart actually pumps harder. So the strength of cardiac contractions, the heart actually pumps harder to push more blood with each pump. And then again, that peripheral vasoconstriction. Peripheral means out on the peripheral, so that's your hands and feet and stuff like that, out at the ends of your blood vessels. Vaso means blood vessels, and constrict means to get smaller. So what that means is it just takes all your capillaries and makes them smaller so that you can pull all the blood to your core, again, to try to keep all your organs alive. So the goal of all this is to keep your blood pressure up, to keep your perfusion working, to get blood flow to all your vital organs. And so this is what causes all the signs and symptoms of shock. So students sometimes get confused. So the cause of shock is like blood loss, which causes your blood pressure to drop, and maybe your heart rate, maybe your heart's not beating as hard as it should be, and that can cause shock. The symptoms of shock are all the opposite of the causes of shock. Your body tries to fight that. So the symptoms of shock are actually, you know, increased heart rate, pale skin because the capillaries are constricted, and things like that. Okay. So what actually causes shock? Well, it can come from bleeding, respiratory failure, acute allergic reaction, overwhelming infection. Remember, like I said, every cause of death you can think of, it's actually caused from shock. First, the person will go into shock, and if it progresses, it'll progress to death. So when all the organs and tissues aren't getting that good perfusion, the organs start to shut down. It could be caused by a number of things. This is just a small list. Okay. So going back to that perfusion triangle, remember the three things that we need to have good perfusion is we need our heart to pump, we need our blood vessels to be the right size to carry the right amount of blood, and we need the right amount of fluid or the right amount of blood in the system. So the cause of shock is when one of those three things fail. So it could be pump failure. Maybe the heart doesn't pump well anymore because the person had a heart attack or trauma to the heart, or the heart's obstructed from pumping in some way. There's some mechanical obstruction that's not allowing it to pump. Okay, it could be a problem with the blood. Maybe there's not enough blood. So maybe there's trauma. Maybe you cut your leg off with a chainsaw and you're losing all the blood in your body. There's not enough blood left to travel around the rest of your body. It could also be a fluid problem with severe vomiting and diarrhea, where you've lost so much fluid that your body actually starts to pull fluid from your blood to keep homeostasis in the rest of your body. Or we could have a problem with the blood vessels. So maybe the blood vessels are actually dilating. You see in this bottom picture here how large all of the blood vessels are. And so there's the same amount of blood as we have up in the top picture, but it's not able to fill up the whole system because the pipes got too big. So if you think about, if you think about pumping water through a hose, if you take a hose off of the pump and you put a larger hose on, you might think it's going to pump more water, but it's going to lose pressure. There's not enough pressure to keep that water pumping through. If you try to take a fire hose and hook it up to your garden hookup on the side of your house, you're not going to be able to have any pressure. There's going to be just a slow trickle of water. There's not enough pressure to fill up the hose. Same thing happens with poor vessel function. If we vasodilate, if all the blood vessels dilate, which means they get really big, there's not enough blood to fill the whole system. So when the heart pumps, there's not enough blood to pump around because there's too much space. Okay, so the causes of shock that we'll really focus on today to kind of get an idea of what shock looks like. How can these things actually happen? Well, with pump failure, we can have cardiogenic shock. Cardiogenic, cardio just means heart. So cardiogenic shock just means the heart's not able to pump anymore. So this would be something like a heart attack or heart failure. Then we have obstructive shock, which is also pump failure. It's where the pump is not able to work because it's obstructed. And we'll look at each of these causes individually. But if you think about an obstruction, it means something's being blocked, right? So a tension pneumothorax is when there's a bunch of air pressure built up in the chest cavity and the heart can't pump because it's under pressure. Cardiac tamponade is when the sac around the heart fills with fluid. And so the heart can't pump because it's trapped by fluid and it can't relax to refill with blood. Pulmonary embolism, we know what pulmonary means. That has to do with lungs. So pulmonary embolism is when there's a blockage in the pulmonary vessels between the heart and the lungs. So remember when our body's moving blood around, the blood goes from the right side of the heart through the pulmonary artery to the lungs, and then through the pulmonary vein back to the left side of the heart. So if those pulmonary arteries and pulmonary veins, if either of those are blocked up, the blood's going to back up into the heart, specifically into the right side of the heart. So that would block the heart from being able to pump. Okay, poor vessel function. What can actually happen to the blood vessels? Well, all the things that can happen to the blood vessels, it's always called distributive shock. If you think about distributing something, if you're going to distribute stuff, you're going to spread it out, right? If you're going to distribute flyers, you're going to go everywhere and put a flyer up. Distribute means widespread. So the poor vessel function, it's always widespread. It's always all over the whole body. And it can happen for a couple different reasons. You can have septic shock, which is a widespread infection, which causes the blood vessels to dilate and get kind of leaky. You can have neurogenic shock, which is like something that's happening to the spinal cord, like a head injury or something like that, or a tumor that's sending the wrong signals to the blood vessels and tells them to dilate. It can be anaphylactic shock, which is from a severe allergic reaction where the blood vessels all overdilate. Or it can be psychogenic shock. So that'd be like if somebody sees blood or something like that, and their blood vessels just dilate all at once. Okay, the last type of shock we can have is a problem with the fluid. So it's called hypovolemic shock. Hypo means low, volemic means volume. So hypovolemic, low volume. So we can have a low volume of blood in two ways. We can have hemorrhagic shock. Hemorrhage means bleeding. So hemorrhagic shock would be like you cut through an artery and you lost a lot of blood. And then you can have a non-hemorrhagic hypovolemic shock. And in that case, you're not actually bleeding, but you're losing fluid through like vomiting and diarrhea, or maybe you've been burned and lost a lot of your skin and you can lose a lot of fluid that way. But you're losing a lot of fluid, but not through bleeding. Okay, so let's look deeper into each of these. Okay, so remember, cardiogenic shock is just the heart is not able to pump hard enough to meet the demands of the body. It's just that simple. It could be a heart attack or whatever, but the heart's just not able to pump hard enough and fast enough to get blood delivered around the body. That's cardiogenic shock. Okay, so it's caused by inadequate function of the heart. And when the heart's not able to pump the blood around the body, that blood backs up into the lungs a lot of times. So one of the signs you'll see for cardiogenic shock is actually, we call it pulmonary edema. So edema is just fluid buildup. Pulmonary edema means fluid buildup in the lungs or in the tissue of the lungs. So edema is that fluid buildup. It can happen anywhere in your body. When it's pulmonary edema, it's in your lungs. And so you can kind of see what that looks like here. If you look at this bottom left picture, this is a normal lung. You have a capillary flowing through the alveoli. And remember, right here, we have oxygen coming from the alveoli into the blood, and we have carbon dioxide coming from the blood into the alveoli. So we have oxygen and carbon dioxide are supposed to be crossing where these arrows are at. And so in a normal capillary, this is how it works. When you have pulmonary edema, what that means is this tissue around the capillary has a bunch of fluid in it. So now that oxygen and carbon dioxide, it doesn't just have to go through a little bit of tissue. It has to go through tissue, but it's full of fluid. So it has to pass through fluid. So it makes it a lot more difficult for oxygen and carbon dioxide to exchange. So that's what pulmonary edema is. Which is, that's going to cause problems breathing, like I just explained that. So that makes sense, right? So if you're having trouble breathing, you're going to have an increased respiratory rate. That means you're going to breathe faster. And we'll hear abnormal lung sounds. We'll hear that fluid in your lungs. Okay, moving on to, this is another type of a pump problem, but it's obstructive shock, where the heart is obstructed from working. There's some sort of mechanical obstruction to where the blood can't refill into the heart, or it can't pump out of the heart for some reason. And we'll go through each of these examples. So the first one's cardiac tamponade. Again, make yourself a note card for this, just to start learning it. Cardiac tamponade is where there's fluid in the sac around the outside of the heart. It's also called a pericardial effusion sometimes, but your heart is surrounded by a sac, and it's just when there's a bunch of fluid in that sac. And so you can imagine if the heart's trying to relax and refill with blood, but there's a bunch of fluid around it, it's not going to be able to open up and fill with blood. So it makes it much more difficult for that heart to be able to pump. This is usually caused by blunt trauma or penetrating trauma to the chest. Basically, a bruising of the heart is what most commonly causes this. The heart sloshes up against the sternum, or if there's a stabbing or something and the heart's bleeding. The only way to treat this is surgery. They'll go in, it's called pericardiocentesis. They'll use a needle to withdraw the blood or the fluid around the heart. And this is rarely ever done in the field. You really need a good ultrasound and all that kind of stuff to be able to do this. A tension pneumothorax. So again, this is when a bunch of pressure builds up inside the chest cavity. So it's usually a hole in the lung is what happens. And so normally when you take a breath, the air goes in your lung, and when you exhale, it comes out of your lungs. If you have a hole in your lung, when you take a breath, the air escapes from the lung and just gets trapped in the thoracic cavity. So it just kind of gets trapped in there. When you exhale, that air stays inside the thoracic cavity. So if you think about that extra air pressure that's going to build up inside the chest, that pressure is going to push on the heart. So when the heart tries to beat, it's being compressed by all that pressure inside the chest. And so the only treatment for this is we need a paramedic, and they can come in and do what's called a needle decompression or a chest decompression. And they put a needle into the chest cavity, and it opens a hole up to let air out to decrease the pressure inside the chest. So they're basically just going to let some air out. It's like putting a needle into a hole in a basketball, right? There's a bunch of pressure in there. If you put a needle in, all the air will come out. Same thing's going to happen to the chest cavity. They poke a needle in, it lets the air out, and then the heart's no longer compressed and the heart can actually start to beat again. So that's a tension pneumothorax. Another way the heart can be obstructed from pumping is a pulmonary embolism. So an embolism is a blockage that blocks blood flow through the pulmonary vessels. So as the blood tries to go from the heart to the lungs and back to the heart, it's going to be blocked. It's going to back up. And so all the blood's going to back up into the heart. And usually it's going to back up into the right ventricle. And this causes the heart to be obstructed from pumping. And so the pumping will fail. Okay, now, so those were all the things that can go wrong with the pump. Now we're going to talk about what can go wrong with the pipes. So remember, distributive shock, it's spread throughout the whole body. All of the arterioles and venules just dilate, and all the capillaries dilate. And all the blood just kind of hangs out in these blood vessels instead of circulating around the body like it's supposed to. So we don't get good perfusion of all of our tissues. We don't get that blood circulating around. It's just kind of gathering in these veins and arteries. Okay, so one type of distributive shock is septic shock. This is from a severe infection that's just widespread throughout the body, and it causes the blood vessels to get really big, and it causes them to leak. So they leak plasma out, and they're big, and there's just not enough blood floating around anymore. To get this treated, a person needs antibiotics to treat the infection. That's really, there's not much treatment for it in the field. For neurogenic shock, so this is from, again, a high spinal cord injury. So it could be like a tumor or something, but it also could be from trauma. You know, you break your neck up super high. And so with neurogenic shock, your brain now just sends the wrong signals, or is not able to send the signals to your blood vessels, and all your blood vessels just dilate. So this is a normal blood vessel at the top here, and this is a dilated blood vessel. So you can imagine the blood that's flowing through here, if you just take that vessel and you make it this much larger, it's not going to have as much pressure. So the blood pressure is going to start to drop. Because again, we took a tiny hose and we put a big hose on. So it's going to lower the pressure. Anaphylactic shock is another type of distributive shock. So anaphylaxis is when you have an allergic reaction, and it's usually it's a very severe allergic reaction. So it's usually something that someone's been exposed to before, and the reactions get worse and worse each time. And you just have to be careful, because a mild reaction can get a lot worse really fast. And anaphylaxis sort of does the same thing as sepsis. It just makes those blood vessels really big all of a sudden. And when those blood vessels are too big, we lose our blood pressure, because you put a bigger pipe on. So 4 ways to be exposed to an allergen. It could be an injection like a tetanus or penicillin shot. It can be a sting from some sort of animal. It can be something that someone ingested, so something they ate like nuts or fish or medication. And it can be something that somebody's inhaled like dust, pollen, or mold. So there's all sorts of different things that can cause somebody to have an allergic reaction. So anaphylactic shock, these allergic reactions usually develop within minutes, sometimes within seconds of contact with the substance, depending on how it was how it got into the body, how it was introduced into the body. And then another thing to be aware of is sometimes people can have a second reaction that happens 1 to 8 hours after the initial reaction. So this could be something hours later. The signs are very distinct. The person is going to be really struggling to breathe. They have that blue skin, cyanosis. And once they get that blue skin, they're really low on oxygen and they really need treatment fast. Psychogenic shock is when it's another example of distributive shock. It's an example of like when somebody sees blood or something and the blood vessels just dilate. It just happens. And usually it causes the person to faint, and that's called syncope. Sometimes it's a serious thing and sometimes it's not. So a life-threatening example would be like an irregular heartbeat or a brain aneurysm that just caused the blood vessels to dilate. But it could be like somebody received bad news or something. So of course in EMS, we're always going to assume it's the worst and go get them checked out to make sure they don't have one of these life-threatening conditions. Okay, hypovolemic shock. Now we're moving on to, first we talked about all the things that could fail with the pump. Then we talked about distributive shock, which is all the things that can fail with the pipes. Now we're on to hypovolemic shock, all the things that can fail with the contents or the fluid, also known as the blood. So hypovolemic shock just means there's not enough fluid or volume in the circulatory system. So hemorrhage means bleeding. So hemorrhagic causes would be somebody's bleeding, either externally or internally. And then non-hemorrhagic causes is where they're losing fluid, but not because of blood loss. So from vomiting or diarrhea or thermal burns where someone's burnt their skin and they're losing a lot of plasma from their blood that way. But one way or another, they have a low hypovolemic volume, a low volume of blood and fluid in their body. Again, it could be from dehydration, could be loss of water or fluid from body tissues, anything like that can cause hypovolemic shock. So these are all going to add to someone who's experiencing shock. Another thing that can cause shock is respiratory insufficiency. Somebody who has, severe chest injury and is not able to breathe, or they have an airway obstruction, or their throat is swollen shut, anything that obstructs the person from getting oxygen in, it can cause respiratory insufficiency, which can cause them to go into shock because their blood won't have the oxygen in it that it needs to deliver to the body. Anemia, we've talked a little bit about. Anemia is when the blood doesn't have enough red blood cells. So the blood's circulating around, you got oxygen coming in and out of the lungs, but if the blood doesn't have enough red blood cells to carry that oxygen, we can still become hypoxic. Remember, hypoxia, hypo, low, oxia, oxygen. It's just a low amount of oxygen in the body. This can also happen with different poisonings. For example, carbon monoxide poisoning. Carbon monoxide attaches to the red blood cells the same way oxygen does, and it actually attaches much easier so that the person can no longer get any oxygen because all their red blood cells are full of carbon monoxide. And the same thing can happen with cyanide poisoning. Okay, so now that we've seen several different causes of shock, let's look at kind of how shock progresses. So when somebody goes into shock, they go through different stages, starting with compensated shock, which is when the body is still compensating for, they say blood loss, but it could be any of those causes that we saw. It's not truly blood loss. It's more like it's compensating for a lack of perfusion. It could be due to actual blood loss. It could be due to the heart being obstructed. It could be due to the blood vessels dilating too large. But either way, the body's compensating. It's working hard and it's able to make up for that loss of good perfusion by speeding up the heart, constricting blood vessels, things like that. Decompensated shock is a later stage when the blood pressure actually starts to fall. So at this point, the heart's beating as fast as it can, blood vessels are constricting if they can, the body's doing everything it can to fight off shock, but still the blood pressure is actually starting to drop. And this is a late stage of shock. And so there's really no, they used to say, oh, there's irreversible shock. There's a certain point when shock is irreversible, when the person's just going to die no matter what we do. But there's no way to know when they've reached irreversible shock. So our goal and our takeaway from this is when somebody's in shock or possibly could be in shock, we want to treat it as early as possible. We want to treat them before they go from compensated to decompensated shock. What we're trying to do is help their body. We're trying to take some of the burden off of them so they don't have to work so hard to keep their blood pressure up. So we're going to take some of that work from them and try to help them. So again, our goal is really just treat that shock early. So looking at the different stages, there are some differences between compensated shock and decompensated shock. It's really good to know all these symptoms of shock so that you'll know, okay, this is somebody who looks like they're showing signs of shock. So first of all, there's some like personality changes we'll see: agitation, anxiety, restless. People will have a feeling of impending doom. They'll tell you, I feel like I'm going to die. I'm dying. I just know I'm dying. You know, if a patient tells you to call a helicopter, you probably need to call a helicopter. They know, they have a sense that, hey, I feel like I'm dying. Weak, rapid, or absent pulse. Pale, cool, clammy skin is really common because, again, those blood vessels constrict to try to pull the blood to the core. Pallor, that word there, pallor, P-A-L-L-O-R, that just means pale skin. And we'll see cyanosis around the lips. Shallow, rapid breathing. We might see air hunger, which is like shortness of breath, especially if this was caused from a chest injury. Nausea or vomiting. A capillary refill that's longer than 2 seconds, especially in infants and children. So remember, everybody should have a cap refill of less than 2 seconds, but in adults, and especially older adults, people may have pre-existing conditions and lifestyle choices that make it so that their circulation is not that great anyways. But in a child or an infant, they should have good circulation. So if that cap refill, if it takes longer than 2 seconds for that finger to return to pink or fingernail to return to pink, that's a bad sign. They'll feel thirsty because, again, their body is low on fluids, so they'll be asking for water. Narrowing pulse pressure. Again, that systolic and diastolic numbers getting close to each other. That means the heart's not pumping very well. So those are all signs of compensated shock. Those all tell us, okay, this person's going into shock, but their body's still able to fight it and they're keeping their blood pressure up. Decompensated shock is when the body starts to fail. So we're still going to help them fight it. There's still a chance they can survive, but it's definitely a later stage of shock. So their blood pressure is falling. Maybe their systolic gets below 90 in an adult. That means they could lose their peripheral pulses. So that means like the radial pulse in the wrist is going to be absent. There might not be any pulse here because their blood pressure is below 90. Labored breathing or irregular breathing. Skin that's ashen, mottled, or cyanotic. Again, like I said, absent peripheral pulses. Possibly thready, meaning just kind of really weak and rapid. Dull eyes because they're losing fluid. Dilated pupils. Poor urinary output. So these are all late stages of shock. Blood pressure will probably be the last measurable factor to change in shock. When you see blood pressure start to drop, that is a late stage of shock. They're deep in shock, and you need to work really hard to get them mostly to the hospital fast, but also try to treat them for shock along the way, especially in children. Infants and children, once their blood pressure starts to drop, that's a super, super late sign. Kids fight really, really hard. Their bodies work super hard to try to keep their homeostasis, to keep their blood pressure up and to keep everything balanced. And once this starts to drop, it's a really bad sign once the blood pressure starts to drop. So we don't want to wait till the blood pressure starts to fall. We don't want to wait until we're sure somebody's in shock. We want to treat somebody for shock in any situation where we think, oh, this person could go into shock. Even if they're not showing any of those signs yet, even the early signs, we still want to go ahead and treat them for shock if we think it's possible that they could go into shock. So this is when you should suspect somebody was in shock. Maybe they have multiple severe fractures, so like 2 broken femurs. I would suspect that person might go into shock, and I'm going to treat them for shock. An abdominal or a chest injury. In your abdomen, you have so many internal organs that can bleed or rupture open and leak out their contents that cause shock. Or chest injury. It's so easy to get a pneumothorax or cardiac tamponade. So remember, pneumothorax is a hole in the lung, or cardiac tamponade is that fluid building up around the heart. It's just easy to damage all those things inside the chest with a chest injury. A spinal injury, because again, remember the spinal cord can send signals that cause the blood vessels to dilate. Severe infection because of septic shock. A major heart attack because of cardiogenic shock. Anaphylaxis because of anaphylactic shock, so like an allergic reaction. We're going to treat anything like this. We're going to go ahead and treat for shock right up front. So as you're doing your assessment on somebody that you think might be in shock, give them high flow oxygen. This helps with perfusion. The blood that is circulating around the body, we want to get more oxygen in it if we can. So give them oxygen to get that O2 sat up to at least 94%. For shock, treat aggressively. Get them to the hospital quickly. Most causes of shock, there's not much we can do. Remember, for the fluid around the heart, they need pericardiocentesis. That's a needle in the heart. We're not doing that in the field. For a tension pneumothorax, that's the hole in the lung that causes pressure to build up in the chest. They need a needle decompression. We can't do that as EMTs. So we need ALS, advanced life support, and we need to get them to the hospital as quickly as possible. Somebody who's breathing fast, that's usually an early sign of impending shock. Somebody with a fast pulse, they're probably in compensated shock. Their heart is beating faster to try to keep blood flow going. When somebody's in shock or in compensated shock, the skin, pale, cool, and clammy. Look for any life-threatening bleeding and treat it at once. Okay. As soon as you recognize shock, start treatment for it. Follow your standard precautions, put your gloves on and all that stuff, and then control any bleeding. You can have multiple types of shock at once. So any bleeding that they have, any external bleeding, that's going to add to whatever shock they're already experiencing. So immediately control any bleeding. Make sure their airway's open, because again, that's going to add to whatever shock they're already having if they're getting low amounts of oxygen. So give them oxygen if their oxygen saturation is below 94%. Maintain manual inline stabilization. Keep their head straight. Support their head, neck, and back if they possibly have a spinal injury. Check their breathing. Check their pulse. Okay. Keep them calm. Try to comfort them. Reassure them. We're going to be at the hospital in 10 minutes. We never lie to them, but we always try to keep them calm and reassure them. We're treating you for this. We're going to be at the hospital in 10 minutes. It's the best hospital, things like that. Never allow the patient to eat or drink anything before they see a physician. If you give them something to eat or drink, two things could happen. One, when you're in shock, remember that your body pulls all the blood to your vital organs and it pulls it away from everything unnecessary. What that means is they're not going to have blood going to their stomach to digest food. So if you give them food or water, there's a really high chance they'll throw it up. And when they throw up, they'll also lose whatever else they had in them. So they're going to be even more dehydrated. Another thing is if they have to go into surgery and they've ate or drank anything, the doctors will have to hold off even longer before they can do that surgery safely, or it could cause complications during surgery. So never give them anything by food or mouth, or food or water. Never give them anything by mouth, whether it's food or water or anything, just nothing by mouth. If you think they have a head, neck, or back injury, take spinal immobilization precautions. Again, keep their head, neck, and back straight. We'll talk about how to do that when we get to trauma, the second half of the class. Give them oxygen, monitor their breathing. Okay. Put blankets underneath them and over top of them to keep them warm. Remember, part of shock, your body constricts your blood vessels and pulls all your blood to your core. That's going to make you feel cold even if it's 90 degrees outside. We're still going to put blankets underneath and over top to help their body compensate so their body doesn't have to try to stay warm on top of trying to stay alive. Again, nothing by mouth, no matter how urgently you're asked. Record the vitals every 5 minutes throughout treatment and transport. And if you have a life pack or a 12 lead or whatever you want to call it, where you can monitor the patient's vitals continuously, that's ideal. Okay. So treating for shock. This is an acronym you won't find anywhere else. And it's not in the book. It's not on the internet because I made it up. So this is an acronym to treat for shock. So for no matter what the cause is, if you go through this acronym, you should treat everything. So the C in COWSAT stands for cause, treat the cause. What that means is if they're bleeding to death, stop the bleeding. If they're having an allergic reaction, give them an EpiPen. If they're having a tension pneumothorax, help them breathe with a BVM. If they're, septic shock, we can't really do anything to treat the cause. What were the other ones we talked about? Pericardial tamponade, there's really nothing we can do to treat the cause. A lot of times there's nothing we can do to treat the cause, but if you can, treat the cause. Give them oxygen. And, think about whether it needs to be a BVM or a non-rebreather, but they're going to need oxygen if they're in shock. Keep them warm, blankets underneath and over top of them to help their body so they don't have to work so hard to stay warm. Lay the patient supine. Supine is the best treatment for shock. We used to do something called Trendelenburg where we raise the legs up. We don't do that anymore. They figured out it was just a waste of time. And we just lay them supine. Now, the reason it says unless contraindicated, if somebody's struggling to breathe, they may be able to breathe easier if they're sitting upright. So occasionally we may have somebody sitting upright if they're going into shock. But put them supine if you can, or once they progress into shock, definitely put them supine. Call for ALS. Maybe medical control in some cases, but ALS can help with tension pneumothorax, pericardial tamponade. They can give a lot of medications we can't give for a lot of different things. So call ALS, or if you're not sure, call medical control and let them sort out whether ALS can help you. And then the T stands for transport. Get that patient to the hospital rapidly. Consider a helicopter if it's going to save on time, but get them to the hospital. So again, C, treat the cause. O, give them oxygen. W, keep them warm. S, lay them supine. A, call for ALS. T is transport. So shock in older patients, we just have to be a little more careful. Older patients have more serious complications. So when they go into shock, their body's not going to fight it off so well. Their body's already working hard a lot of times. And once they go into shock, their heart can't pump any harder or faster than it already is. They don't have the extra blood supply that a younger person does. So if they start losing blood, they don't have that much blood to spare. They're already trying to stay warm. And so their body's just not very good at compensating for shock. So, be extra careful. Treat them for shock way before you see any signs. Another thing is we may not see the signs of shock we expect in an older person. If they have a bunch of different medical conditions where they take different medications, the medications can cover up the signs we would expect to see for shock. Or the medications can even mimic the signs of shock. So maybe they take medications that speed up or slow down their heart rate, for example. So they have a fast heart rate and we think they're in shock. Or they have a slow heart rate and we think they're not compensating for shock when actually they are, but their medication won't let their heart speed up. So anyways, for elderly people, just make sure that for everybody we treat for shock way before we even see the signs. If we think there's even a possibility, treat for shock. You're not going to hurt them, right? It's oxygen, blankets, lay them supine, and transport. Call for ALS and treat the cause. I mean, not anything major. So if there's any possibility of somebody going into shock, treat them for shock, especially for older patients. Even if you're not sure, the mechanism of injury or the illness that could cause shock in an older patient is much less than what it would be in another person.